Across the country, family and friends are gathering around the table for a second Thanksgiving in the pandemic. The difference is this year, of course, vaccines. According to the CDC, less than 60% of adults are fully vaccinated. Meanwhile, more than 53 million Americans are expected to travel for today's holiday. Medical officials say they're worried this could potentially trigger a spike in new cases. Michael George has the latest.
Friends and families across the country are sitting down to feast this Thanksgiving Day, but there's concern getting together for the holiday could have more consequences than a few extra pounds. A new CDC forecast predicts COVID hospitalizations and deaths will be on the rise over the next few weeks.
Even a small surge in COVID right now is going to put our hospitals absolutely over the edge.
COVID cases are already on the rise in 24 states, and hospitalizations are up in 22.
We know there are already surges across the Northeast and the North. And as an ER doc, I can tell you our hospitals are already overwhelmed.
While hospitals are dealing with the crush of COVID cases from the Delta variant, health experts worry that until more people are vaccinated, new mutations have a chance to form.
This Delta variant spreads so easily, it is crowding out any other mutations right now, but there's certainly the chance for something worse. And our best protection against that is vaccinating not just the U.S., but also the rest of the globe.
The World Health Organization is meeting today to discuss a new variant. The B.1.1.529 variant has been found in South Africa, Botswana, and Hong Kong. Doctors say the variant carries mutations which may make it capable of avoiding immune responses. But they add it's too early to know exactly how transmissible the variant may be. Michael George, CBS News, New York.
Here to discuss this more is Dr. Lakshmana Swamy. He's an intensive care physician at Cambridge Health Alliance and Boston Medical Center. Doctor, thanks for joining us. Now, what is your advice for people gathering today, especially if not everyone is vaccinated? Is there a safe way for people to celebrate, and is there a polite way to check the vaccination status of your, distant relatives without causing people to throw turkey in your face?
I think you've really hit the nail on the head. So thank you for having me. Happy Thanksgiving. It's a kind of a bittersweet day where it's such a day of celebration, and yet we are starting to worry a little bit. It's hard. I've had many family and friends ask, how do I talk to this person who's unvaccinated, who is kind of insisting on being here, and it's hard to push back against that. I think at this point, the people who are in these situations are in these situations. You're vaccinated, I hope, but you've got unvaccinated people coming to your home. It's risky for them, and it is a little bit riskier for you as well. Here's what I would suggest. First of all, use the point of care testing, the antigen testing that's available in drugstores if you can afford it. I think that's a great way to try to help. If it's positive, then you have much more to go off of to say, hey, look, we can't do this. Now, on the other hand, if you've got unvaccinated people in your home, and if you're gathering with just a lot of families, a lot of people, more than 3 families traveling from out of state, more than 10 or more people, I would start to worry and say, here's a time when you might want to do those uncomfortable things to make it a little safer, improve the ventilation, crack the windows, put the fans on, and yes, use the masks.
Just make sure grandma isn't seated next to the open window. I know mine is always cold no matter what temperature it is, no matter how many heaters we put on her, but we love her and we're trying to keep her safe. So if you're trying to keep your family safe and you have unvaccinated people who are coming to your Thanksgiving or your holiday gathering, is that negative rapid test, is that enough? Should that make you feel safe? Or at some point, if you get enough people, is it dangerous even if people have negative tests? And when should you be getting that test?
Here's what I would suggest. If everyone's able to do a negative test before even leaving their homes to travel, that really does go a long way to say, hey, that's going to catch a lot of people. I've been involved in many cases where that has changed travel plans because someone who's asymptomatic came up positive on the negative test and they didn't join the trip. So I think it actually does quite a bit. If everyone has tested before coming, that adds quite a lot. Feel safe is tough. Feeling safe is different for everyone. And I'm sympathetic to the people who, despite what precautions one may take and being vaccinated, still don't feel safe. That kind of, really takes the fun out of the holidays.
Right, because, I'm vaccinated and my family's vaccinated, but my bar for safety might be different than someone else who might be vaccinated and still want to wear a mask, and that may not go over well with everyone. So, in addition to religion and politics and the usual Thanksgiving topics, now we've got COVID in the mix. What concerns you most in the weeks and months following this holiday season? Are you worried about a spike in cases?
I'm certainly worried that we're going to see spikes in cases. Now, on the other hand, am I worried the same way I was last year? It was very different. We didn't have vaccines. We also didn't have a Delta variant. So we're in a different world right now. And I think, to be honest, it is hard to predict what will happen. And I think it's important for families to really look at what's happening in their homes, who are they exposed to, and what are they going to be on the lookout after the holidays are over. Because it is really possible that the virus is going to spread in sort of medium-sized indoor gatherings with people coming from all over, a lot of hot spots. I'm worried about that. And there's also downstream implications beyond people simply getting sick, which we don't want. But, this leads to missing school, quarantine, all that stuff.
So you're based in Boston, Massachusetts. What is the coronavirus situation like right now? Is it better than it's been? Is it worse than it's been? And what is it like being a treating physician?
I think what I would describe it here as tense. We're anxious. And the reason that I would say that is cases are rising. We are seeing more people with COVID in the hospital, in the ICU, than we were before. We're not yet at a point where I would say we're in a big surge or anything, but already we're starting to see changes made to elective surgeries and that kind of stuff to kind of prepare. And I have to echo what so many other doctors are saying, which is that we're just already so crowded and so busy. And, one really sick coronavirus patient is a lot of strain, and to have a lot of them come in at once, that's what I'm really anxious about.
Is the resources that it takes to care for these patients and pulling them away from other emergency or even important elective surgeries that may not get done because you have to care for these COVID patients?
That's exactly right. And, it's the number one resource is really the staff, right? We have physical beds, we have ventilators, all that stuff. But the staff, it's a huge problem. We're losing staff. Staff are working so hard to try to fill in the gaps. And I'm worried because we're seeing the numbers climb up. We've been doing okay for a while watching other parts of the country. But here in Boston, I think we're worried because we are already so busy.
I know you guys have been running nonstop, and we do appreciate you, although I know that's also ringing hollow after this many months. As mentioned earlier in our reporting, the World Health Organization is meeting to discuss a new variant found in South Africa, Botswana, and Hong Kong. What do we know about this variant so far, and do we know how it compares to Delta and how it's going to be impacting our lives?
Yeah, so this is, the first thing I'll say is that it's very early to say whether this variant will kind of really be important or not. But it's important enough that they're meeting about it and that we're talking about it. So what makes this variant important? It's the concern that there's so many mutations in that spike protein. There's so many mutations that maybe it's going to be better at evading the protection that vaccination gives us. That's my main concern hearing about it. Now, I'm not really that worried about it. I'm not in much of a panic about it yet. I think it's important to watch it and track it closely. I wouldn't change anything we're doing right now, and I absolutely wouldn't say this is a reason to think vaccines aren't effective. The reason I say that is that this virus is in an incredibly competitive atmosphere of its own, and Delta is running the show. So it is not going to be easy for a variant to kind of overcome that. But the concern is, on the other side, that as long as we don't have true global control of this pandemic with widespread vaccination, we will still see these variants pop up. And it is just a matter of time. I hope this isn't the one. I hope we can stop it before we get to the one.
Doctor, thank you so much for all your work. Thank you for joining us on your holiday. I hope this wasn't one of your few days off, and we'll be back in touch, have you update us as this goes forward. Thank you.
Thanks so much.